Hello friends, today we will discuss with the female infertility. Female infertility. We can see that in order for a woman to become pregnant, there should be some prerequisites like egg must be released from one of her ovaries. The egg must go through the fallopian tube towards the uterus. The sperm must join with the egg in the fallopian tube for fertilization. The fertilized egg must attach to the uterine wall for the process of implantation. And if there is any obstruction in any of these steps, it may cause with the fertility cycle of a female and can at last lead to infertility. Even there are other problems which can cause infertility in a female, like if the woman, if she is 30s and who have been trying to become pregnant for last 6 months, if she is not able to conceive, she should see the doctor. Women with the following problems can also should go and consult the gynecologist, like if she is having a irregular period or no menstrual cycle or very painful periods, endometriosis, pelvic inflammatory diseases, or who is been facing more than one miscarriages. We'll be discussing one by one. Other factors which may cause the increase in the risk may include the age, like after the age of 32, the women potentiality to conceive declines. And a infertility in old women may be due to high rate of chromosomal abnormalities that occur in the egg as the egg become aged. Older women are also more likely to have health problems which may interfere with a normal fertility. The miscarriages also increases as the women age. The other factor being stress, poor diet, smoking, alcohol, STD, sexually transmitted diseases, overweight, underweight are all other factors which causes infertility. Will include added on by the intake of lots of coffee, caffeine, and too much of exercise can also add on to infertility. Now we'll discuss in detail with the causes, the common causes of infertility. It can be of different types like severe endometriosis, pelvic inflammatory diseases, ovulation disorder, elevated prolactin, polycystic ovary syndrome, early menopause, benign uterine fibroids, and pelvic adhesion. We can classify all those causes into five categories like physical obstruction, hormonal obstruction, fertilization, early stage of development, and other causes. We'll start with the first category, that is physical obstruction. So here we have classified the other things what we have discussed earlier into different classes. So the first being the physical obstruction. As the name indicate, if there is a obstruction physically which may be causing a hindrance in conceiving, we have added all those causes here. So first being the endometriosis, pelvic inflammatory diseases, uterine fibroids, pelvic adhesion, and ovarian failures. We'll start with the first one, endometriosis. What is it? It occurs when the uterine tissues, which should be seen inside the wall of a uterus, where uh, which happens to by mistake get implanted in other areas other than the uterine wall. Like if the tissues, the uterine wall, this endometric tissues, they by mistake they get seen on or implanted on other areas like outside the uterus, within the ovary, or in outside the fallopian tube. If this happens, we call that condition as a wrongly implanted endometric tissues in other parts other than the uterus. We can call it as the endometriosis. So what happened if these tissue by mistake, if it is been it gets implanted in the fallopian tube, which is a hollow tube through which the uh, egg should move to the uterus. So what happened is that if this scar tissue get implanted inside you could see here, if it is implanted in the inner wall of the fallopian tube, this scar tissues may form a block, and it may block the movement of the egg as well as the fertilization process. There is about 23 to 35% of the rate of infertility in uh, in women is being accounted to because of the endometriosis. Next is very interesting factor, that is pelvic inflammatory disease, which I can also call by term short form as PID, pelvic inflammatory disease. Here, actually, this is not a single condition. It has been a spectrum of infection. It has been caused by a group of infection. We cannot simply say that it is this PIT is a condition caused by particular X factor or Y1. It is but then caused by as a result of many type of problems or many infection spectrum of infection in the female genital tract. Maybe like endometriosis. It can be a condition caused after endometriosis or tubo-ovarian abscesses or salpingitis. Salpingitis simply means inflammation of uterine wall, or it can be a like tubo-ovarian abscess, a large abscess or obstruction involving the uterine tube and an adherent ovary, and or it can be a peritonitis, that is inflammation of the peritoneum. So all these may be included under pelvic inflammatory diseases, and it can lead to like infection of the by the infection of the uterus or fallopian tube or other reproductive tract. So all these like endometritis, salpingitis, tubo-ovarian abscesses, peritonitis, all these can be grouped under this one. So here, as a name indicate, pelvic. Pelvic means lower part of the female uh, our body, pelvic region, from our thigh region, the pelvic region, from the abdomen region, we can include it as the pelvic region. And if there is a inflammation, if there is the inflammation swelling, and if it is caused by many infection, we can classify it as PID. And it is a serious complication seen in STDs, sexually transmitted diseases, especially by infection by chlamydia, gonorrhea, and all that. And it can damage the fallopian tube, tissues of the nearing uterus and ovaries. Another problem is that, as we could see, that well, if this is the normal fallopian tube, you could see that here it is having a large lumen. But then, as PID happens, when there is a swelling in the inner wall of the fallopian tube, the lumen get reduced, so it obstructs the pathway of the movement of egg. Third one is the uterine fibroids and pelvic adhesion. So this is a kind of problem in which fibroid are formed. What are fibroid? Fibroids are benign tumors, and these are seen in the walls of the uterus. Here the picture shows these are the fibroids which are being formed in the walls of the uterus, and they may cause infertility by blocking the fallopian tube. So sometimes this fibroids get formed at the lumen of the fallopian tube and it blocks it. Another problem is pelvic adhesion. As a name indicate, it is a kind of adjoining of the tissues. So here, bands of scar, unwanted tissues may develop, and that bind to the different organs. After it may be because of pelvic infection, it may be because of as a result of appendicitis or abdominal or pelvic surgery. Because of all these things, some scar tissue may develop, and this tissue may form a network mesh like condition. It will tissue of here will be joined here, and it will form a kind of band like condition, and that will join different organs, like for example ovary joining the fallopian tube, a tissue of the uterus joining the fallopian tube likewise. And this may cause a kind of mesh which will be preventing obstructing the free pathway of the fallopian tube, causing infertility. Next is the ovarian failure. Ovarian failure can be a consequence of a treatment, or maybe because of the ovary development, or egg in the first place, like in the case of Turner syndrome. If a person is having Turner syndrome, she may be not um, she may not be having one of the X chromosome. Like normal females, if a normal female normally have two X chromosome, but a baby born with a Turner syndrome may not be having one X copy. So she will be having only one X chromosome. So by birth itself, because of this chromosomal issue, she is not able to give develop the a proper ovary. So ovarian failure indicates if the ovary is not properly developed, or it may be because of Turner syndrome likewise, or if because of some treatment, medical treatment, the ovary might have failed, or the because of other reasons the ovary is not possible, is not having capacity to develop the egg. And here we can see that this ovarian failure can also occur as a result of treatments like chemotherapy, pelvic radiotherapy for cancers. And the therapies, what they do is they destroy the ovary structure or egg, the eggs within the ovary. So here we'll stop for the day.